Hi, Dr. Wood, author of the book Miracles in Minutes. Today I'll offer another secret from the book. So today we're going to cover shoulder and neck pain. And again, we're going to kind of go down to the ankle. Not saying it's going to work every time. I'm going to give you two different scenarios that I found that worked on patients. Now, some of this stuff is going to sound pretty absurd and it doesn't make sense. Like, why are you talking about I have neck pain up here? Why are you looking at my ankle or foot? Or I have shoulder pain up here, and why are you looking somewhere else? So it all started with the way doctors were taught anatomy and dissection. It was more of like a butcher's perspective, like, anterior deltoids here, medial deltoids here, it's your trapezius. But muscles never work independently in the body. Everything works together. Like, you're not just a heart, it's your heart, your kidneys, and all the organs working together. And if you can't digest food, then your heart doesn't work and you have a brain. So it's always, the whole system's always working together as an integrated matrix, or as a whole. All the parts come together and creates a bigger whole. It's kind of like your car, it's not just a tire, it's everything working together. So I say this, but it's our natural tendency as humans that whatever hurts, we want to rub it, we want to ice it, we want to do something to it. But if you notice, if you take a look at that principle in the long run, it doesn't work out. So as a chiropractor, with 21 years clinical experience, probably about 13 to 15, when I wrote the book, I kind of shared some of the caveats I saw from practice of what was working, what wasn't, was producing, as I call it, miracles. People would come in with severe pain, all of a sudden, next thing you know, they'd be better. And I didn't understand it. I just know it was working at the time. Fortunate for me, someone gave me a book of a new dissection called Anatomy Trains. And I'm going to show you a little of that today. So we're going to turn and we're going to look at this book here, Anatomy Trains. And you can see that muscles connect to muscles. So if you have a problem down here, surprisingly, it could cause a problem in your lower back. It could cause a problem in your neck, or it could cause headaches in the front of your head. Tight calf muscles, just like if it's pulling down here, it'll make all this tissue tight, and you're going to have a problem somewhere else. Now, that's just one line. So, the body needs to stand up, it needs to balance itself, and that's just one way of looking at it. There's another line that's called the superficial back line. That's in Tom Meyer's book, Anatomy Trains. I highly recommend those who are practitioners get that. It just makes sense. You can look at some of his YouTubes too if you're a layperson and want to understand a little bit more. Now, here's another line. It's called the spiral line. And everything that generates power in this universe operates from spin or torque. So the earth spins on its axis, a tornado spins, a hurricane spins. You can see that's great power. You throw a football, it spirals, it spins. Baseball spin. The ocean waves spin. So you see spin is a powerful force, and our bodies can generate a lot of athletic power and do some wonderful things with spin. Now, how's that relevant to us, or how's that relevant to care of you, the patient? Well, it helps you to start seeing that sometimes a problem in one side of the body can lead to something really far off. So if we look here, you can see a problem in this ankle. If we follow this line up, coming up like this, next thing you know, look, it's going from the inside of your pelvis here, your abdomen crosses over to your opposite rib cage. If this rib cage becomes funky, it can mess up the opposite shoulder, or you can see on the back side of it, it's coming up here like this, so a problem in the same ankle can cause a problem in the same side shoulder. So it starts to sound a little complex, but you keep it real simple. Only thing you come in looking for as a patient is, what do you want? And you're like, I want to, feel great. I want to be able to throw the ball again with my kid. And you frame it in positive language, what you do want, not like, I don't want my shoulder to hurt anymore. You want to frame it like, I want to be able to throw the ball fast and hard and have a great time and my arm's fluid. So first you set that goal like that. If you see it that way, then your mind actually starts looking for an answer and come up with suggestions you never thought of. So this kind of goes into multiple things. So my whole book is based upon, hey, look, you could do something that seems not connected, but it is connected. But we don't really know everything about anatomy and how the brain wires everything together. Keep it simple. If it works for you, do it. If it's not working, quit. So that's one of the big principles. So there's some calf stretches that I do. I'm going to show you one of, like, you could put your foot like this just up on the wall and just stretch and see if that relieves your neck pain or shoulder pain. I've done that for a lot of people who have lower back pain or neck pain or shoulder pain. Boom, it's gone in about 30 seconds. So the goal is to give you something quick and fast that work for you. Hope this video helps you out. Dr. Wood, author of the book Miracles in a Minute. You can pick it up at Amazon.com if you want to learn a little bit more and try how to use this matrix and help yourself out. Have a great day.